Okay.
All right.
Good job.
All right. And if you all put on your view to speaker, we can just talk, listen to her. When she gets on the screen, Shirley, are you there? She is somewhere.
Yes.
Okay.
Yes.
I
Can
have
you
to
not see?
too much because you always help us out every fall. And you're so faithful, even though, well, I'll let you tell the rest. So,
Want to introduce her, Nancy?
hmm?
Want to introduce her?
This is Shirley Thomas. So did I speak? I don't
Yes.
know if I'm on mute. Okay.
Your screen is off. Your video screen is off.
Right. Sorry, I'm trying to learn how to do this with my phone.
Oh,
So, anyway, thank you, Shirley, for coming. I think you all know Shirley, kind of now the head of the SHIP program that helps everybody with the Medicare issues, Medicaid issues. So she is here to speak, even though I guess part of the government is shut down right now. So it's very nice of you, Shirley, to come. And I'd say go ahead, Shirley. I'm going to go put myself back on mute.
Okay. Good afternoon, everyone. Thank you for having me again. And it has been a really rough year. Okay. Um, we were supposed to be trained in late August, early September. And then we were told that the people that were going to train us were furloughed. They were transferred to another place. It's okay. So we're waiting for the training, and then they had the shutdown. So instead of training, we got a fact sheet from them. Okay. I don't believe this administration was ready for the Medicare open enrollment. I don't think they really understand, and they don't understand the timeline. So I'm going to give you the best that I can. Everyone here is already on, so I don't have to explain the different parts. Okay, then I will just share the coverages for medication because some people were confused about that, and there were some issues about some medications not being paid for, and then finding out that they were asking for the wrong part of Medicare to pay for it. So Medicare Part A covers the drugs you need during a Medicare covered hospital stay or a rehab stay. Part B covers a limited number of outpatient prescriptions under certain conditions. And they cover our vaccines. Now, this year it has not been confirmed whether or not they've added the measles shot to the list. But they were fighting all year because they did not want us to have our vaccines free in 2026. They did not want us to be covered for the preventative care that we get every year. Of course, they lost that fight. It will happen. But for the vaccines, you need your doctor to write a prescription, and I'm guessing, I didn't see it in writing, but I'm guessing that means that the doctor writes the prescription and you go to the pharmacy and the grocery store in order to get your vaccines this year. If you have your shots in the doctor's office, it's going to be a doctor's visit and you will be charged for that. The Part D, as in drug, covers most prescriptions that you received at the local pharmacies. And your Advantage plans or other health plans with drug coverage and their prescription drugs will be covered under D at the drugstore. Okay, you have to make sure that they're medically necessary and you can prove that they're medically necessary and that they're relevant medications and not something that you have gotten from someone else, some other entity. Okay. The let me go to the Advantage plans. The Advantage plans this year have changed. A is the same, there are no big changes with A. B is the same, no big changes with B, but it's the Advantage plans and the prescription drug plans now. The Advantage plans have gone from, they're like the ones that the state workers have. Now they have categories or tiers of Advantage plans. They're going to be basic, there's going to be basic plus optional, and there's going to be basic plus mandatory. So the basic Advantage plans must include all of A and B medically necessary services for all enrollees. It may include prescription coverage, but it may not. And the maximum in-network out-of-pocket costs will be $9,250. That's the basic. Then for the basic plus optional, you choose to add extra benefits and may require additional costs. So that means that some of these benefits that you want, they have it. It can be offered under the plan, but you'll have to pay for it, and your co-pays and co-insurances will be higher. Common examples will be the dental, vision, and hearing coverages. The federal government has decided that they're not giving the insurance companies funds like they did before. And so the insurance companies have got to try to work within their budget. And if they see that they're going to go over the budget, then they have to request funds from the federal government. And that's going to be the same thing with the state. We're not getting the funds from the government. Kemp is going to have to try to work within the budget that he has. And he's always been done well with the budget, and we've had excess. What I'm not anticipating is having any excess this year, but trying to work within that particular budget. So the basic plus mandatory Advantage plans may require additional cost sharing. So that means that yes, there's going to be additional costs. When they say may, it definitely means yes. Common examples will be gym membership. So instead of all of the Advantage plans, including gym membership, now there are going to be some with no gym membership. But if you want it and you feel that you need it, there will be an additional cost for you to have it in your Advantage plan. Okay, and that's pretty much like the state insurance where they have the silver, bronze, and gold plans. That's what these Advantage plans are going to be like. The extra benefits that had been offered will no longer be offered to everyone, and it will only be offered to chronic illness supplementals. So, for people with 2 or more chronic illnesses, that they can prove that they have these chronic illnesses, they will get extra benefits like meals, non-medical transportation, and pest control, and that sort of thing that was offered before, but no longer included in basic Advantage plans. You have to have a reasonable expectation of improving or maintaining your health or overall function if you get these services. The plan can vary on a case-by-case basis on what they will include in that particular plan for that particular person, but they're called special supplemental benefits for the chronically ill, and you have to have two or more and prove that you have them. You have to be at high risk for hospitalization or other negative health outcomes if you do not get these services. Okay. So what they're trying to do is do away with all of the extra benefits they added when the virus came. They're trying to do away with it and go back to the basic advantage plans that we had before with minimal extra coverages and services. There is a thing called a NOMNC, which is the Notice of Medical Non-Coverage. This year, a lot of people have been getting those in the mail and they've been filing appeals, and some people have won the appeals and some people have lost and had to file additional appeals. And they passed a law, CMS passed a law that if the Advantage Plan decides to terminate coverage, they have to send out the notice. And if the person files the appeal and wins the appeal, they must be able to explain what has changed to warrant a second notice of non-coverage. Because some people have won their appeal and got a second notice saying it's still not going to be covered. We're still not going to pay for it. So now they have to explain what has changed and why they're not going to cover it. If you find that you receive two or more of these notices, that they're not covering something that was covered before, that they're not going to honor the one appeal, then get in touch with Medicare or in touch with SHIP so that we can fight this and find out why they are doing that. And now their notice of their fact sheet that they sent out to us. In Georgia, there's 1,973,774 individuals who are enrolled in Medicare. For 2026, the average monthly Medicare Advantage Plan premium has changed from $13.76 to $6.74. So that means they're lowering the premiums for the Advantage plans. There will be a lot more zero premium plans available. They have narrowed down from 170, well, that's going up, 178 plans in 2025 to 180 Advantage plans. Now, I have seen more than that. So I'm wondering, how are they going to go down from 400 Advantage plans to 180? I have, that means to me that there are going to be some consolidation of plans like they did a couple years ago. So you need to check. And everyone will be available to access these Advantage plans, and everyone will be available to get the zero premium plans. What this says to me is that within the next couple of weeks, if you have not already gotten the annual notice of change, read it. When you get it, read it, because they have consolidated plans. Plans have left the state of Georgia. What did I do with that notice? There were 4 Advantage plans from Cigna that have left. There are 2 United Healthcare plans, 2 Humana plans, and I think one Anthem or Aetna plan that has left. The Sonder plans and the Cigna and United Healthcare plans left in the in August, and people had to get new plans for the rest of this year, not just looking for plans for next year, but I had to get new plans for the rest of this year. Sonder, anyone that was on Sonder, if it sounds too good to be true, it is. They had lowered their co-pays and co-insurances to $10. They offered extra benefits, and they had this wonderful podiatry system where the people would come to your home, and it was like you're at the spa. They soaked your feet, and they pumiced your feet and lotioned them and clipped your toenails and lotioned all the way up to your knees, just like you're at the spa, but in your home. And what we're finding out is that they did not pay the doctors in the hospitals. So they were providing all these services, but not paying the doctors in the hospitals. So they were more than just sanctioned. They were, their license was taken away, and they no longer have Sonder plans in the state of Georgia. For Part D, for the drugs, there are 10 standalone Medicare prescription drug plans available in 2026. And before, you may have seen that there were like 14 or 20 prescription plans available in your area. Now there will only be 10. Everybody has access to these 10 standalone plans, and I have heard, I need to look at the name, Alliance, that they have petitioned to stop providing standalone plans in the state of Georgia. And let me get the correct name. That's what I'm looking for. Elevance. Elevance is a parent group for AmeriGroup, Anthem, Blue Cross Blue Shield. And they have petitioned to get out of the Part D prescription plan business for 2026. So that means if you have a prescription plan through Anthem, prescription plan through Blue Cross Blue Shield, please read your notice to make sure that they did not cancel your prescription plan and now you are without one, okay? Or they've placed you in another plan that they already have, okay? Please read your notices. If you have an Advantage plan, if you have a prescription drug plan, original Medicare and a prescription drug plan, please read your notices because these are big changes. These are big changes. And I have had someone come to me recently who's, I guess the Humana plan left, and the Humana just switched them into another plan. They went to the pharmacy, and instead of zero cost for the medications, there was a cost for the medication, and they had to pay for it. And why? We looked it up. They got switched to another plan that had no prescription coverage. So they had to pay for their medications for the rest of this year, trying to fight it to see if they can get a special enrollment period because they did not ask to be switched. And so that they can have prescription coverage for the rest of the year. So please look at your notices. They say that 28.4% of the people with standalone prescription drug plans qualify to get extra help, and they have not applied. So they do want you to apply for extra help. And if your income is around $23,000 a year, you should qualify for the extra help. They have said that if you're receiving Social Security and your income is low, or if they noticed through some of the programs that you're already in that you qualify for these programs, they're going to automatically do the application and enroll you. Don't count on it. Please check. Um, just to make sure, just like they said, if there is a couple, let me go over for the Medicare savings plan for an individual, if your income is $1,325 or less, for a couple, $1,783 or less, then you qualify for QMB, which is Qualified Medicare Beneficiary, which will pay for the Part A and the Part B premiums, co-insurances, co-payments, and deductibles. If your income is $1,781 for an individual, $2,400 for a couple or less, then you qualify for the state of Georgia to pay for your Part B premium. They look at your income first and then they will look at your assets. Your assets cannot be high. It can't be higher than $9,660 for an individual and $14,470 for a couple to qualify for these programs. And they do say that they're going to automatically enroll you. The extra help, your assets can be higher, but your income still has to be low, around 18, 19,000 a month. So 1,900 a month. So they said they're going to automatically, but if your income is low, check into it and do the application. If you have a Medicare Advantage plan, the Medicare Advantage plan now has contractors that will help you with these applications. And examples of two of the third-party contractors are Benelink and Optum Change. They will supposedly get in touch with you and do the applications, or they'll do the applications for you and you'll be getting a notice saying whether or not you qualified. Or with a couple, the person that appeared to need the services more would be approved and the other person would not. We shall see. And know that SHIP can help you with those applications. We're not a contractor. Um, the Medicare savings programs are through Gateway. And if you decide to do it yourself, I suggest that you do it online through Gateway because it is date and time stamped. If you decide to do a paper application, which you can, they will mail it to you. You complete it. You either take it in or you mail it in, and it goes to someone. If you take it in to the receptionist that stamps it and puts it somewhere, if you mail it in to the person that's opening up the mail and supposedly stamps it and puts it somewhere, and then the workers are not all in the office, so they either are given to the workers that are there at the time, or someone comes in, picks up the application, works on it, or picks it up and takes it home. To me, that's too many hands. And that can lead them to losing some of the paperwork that you need to have with the application or losing the application altogether. So if you do it online, then it is date, time, and stamped, and everything is in the computer. If they say they don't have it or they don't have certain paperwork, it is there to prove that it was turned in. Okay? The Medicare and You handbooks are coming out. Some of them have arrived. Be on the lookout for them. They started in mid-September mailing them out. And from what I have noticed, they were not ready when they mailed them out. They still have the 2025 premiums in there. They still have Sonder special needs plans in there. Some of the things should not be in there, and they're still in there. So they were not ready. But basically, the services for A did not change, and they did not do anything drastic or add anything um, to services for Part A. For Part B, they did not add anything. What was it, a couple years ago when they added the lift on the wheelchairs, but they haven't done anything major like that since then. So there haven't been any big changes. The big changes have been with the Advantage plans and the prescription drug plans. Okay. They claim that Medicare.gov will have all of the answers that you need if you have more questions. So know that you go on Medicare.gov, the official site, if you have more questions. Also, call SHIP because even though they didn't train us and they're not being as transparent as they have been in the past, we are still searching and looking and trying to get all of the answers and know all of the things for you. As far as Part A, well, as far as the premiums, they have not shared what the premiums are going to be, and they have said that they're going to know for sure and post them in November. Well, for right now, I'm going to tell you what I have read and what I've heard. For Part A, the premium they have not shared. I have not heard. For Part B, the premium this year, average premium, $185, is supposed to go up to $206.50. The deductible, 257 this year, is supposed to go up to $288 next year. Okay. So it again is not in writing. They haven't confirmed it, but that is what I have read from, I'm hoping, a reliable source. $206.50 for Part B and $288 for the deductible. Okay, for the prescription drug plans, they have an average cost of $38.99. But for the most part, there are still a couple zero premium prescription drug plans and still some very expensive prescription drug plans. Do not be fooled by the premium. That does not mean that it pays more or that it's better for you. The negotiations for the medications continue. They tried to stop it and then they couldn't. So they're still negotiating some medications, and CMS reinterpreted the statute for the coverages for anti-obesity medications. So they will cover the anti-obesity medications this year, but it has to be for someone that has health concerns and are obese and not just overweight. They did not give the guidelines as to how obese, morbidly obese probably, but they have to be obese, not just overweight, for it to be paid for. And it will be paid for with Medicare, Prescription Part D, and with Medicaid. Let me see. The Plan Finder, Medicare Plan Finder, that's on Medicare.gov, if you've gone through that and you've done the comparisons yourself, supposedly they have been updated, and now the provider directory is included so that you do not have to. They changed it a couple years ago, and you would look it up. And then to know for sure whether or not the provider was in the network, you would have to either look up the insurance website or speak with the provider directly. They say that on the Plan Finder tool, the directory is there. The insurances are supposed to keep up to date with the correct information about providers, because some providers were on the list, and then when people made the appointment and went, the provider was not in the network. So now the provider list is supposed to be up to date. If you find that you enrolled yourself in a plan because you thought your provider was there and found out that the provider was not in the network, you get a special enrollment period to change, and you get 3 months to change from that plan to another one where the provider is actually in there. Let me see what else. And we know that the January 1st through March 31st, where you can change to a new Advantage plan if you find out after you have tried to use it and found out that the provider was not there. But you do get a special enrollment period. Let me see, what else did they say they're going to do? And then the greatest change has been with this HR1 bill. Okay, in July it passed, and it is saying that Medicare is restricted to U.S. citizens, permanent residents, that's the people with the green card, Cuban, Haitian entrants, and certain people residing under COFA. So that's like not refugee. When they're asylum types, that's why they're here. They will continue to qualify for Medicare. Illegal non-permanent are at risk for losing their Medicare and their Medicaid. Current Medicare coverage for those that do not fit the above criteria will have lost their Medicare, their Medicaid by January 2027. So all year they'll be throwing people off of Medicare, Medicaid. And that's it. That's it. That's all I know. Any questions?
Wow.
Not yet. Okay, just remember to read your notices, see what it is that you have. Um,
Shirley,
yes,
can you remind us what SHIP stands for and your contact information?
sure. SHIP stands for State Health Insurance Assistance Program. And you can reach the office at 877-220-0127. My number 470-249-3973. And then the state number 866-552-4464, and press option 4. Anyone, SHIP Help Let me get that number for you if you're not in Georgia and you want to speak with a SHIP person. 877-839-2675. That is the SHIP number, and you can find the SHIP that's in your state.
And your number again, can you repeat that?
470-249-3973.
Okay, thank you.
You're welcome.
Shirley, I have a question.
Sure.
You talked about assets couldn't be more than 9,000 in something or another. What does that mean? Your house and your car and all that?
No, that just means what you have in your savings account or a certificate of deposit or some account that you have.
Okay.
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 They don't count your house. They don't count one car.
Okay.
Okay. So if you have two cars, they will count the other car.
Yeah. Thank you.
Sure.
The thing about the 2 chronic illnesses, is that always been like that for?
No, it has not always been like that.
Okay.
Yeah.
Trying to
They're
think of-
making it more difficult to get the extra
Right.
benefits.
Yeah. So the extra benefits was like a monthly 175 or something. Is that which one we're talking about? I know I just got on a new plan. They had things like that. So I don't know how I got them. or if they'll go away. I'd have to get sicker.
You have to get sicker. That's right. No, what they used to include, I guess that was the mandatory. They used to include the dental, vision, hearing, gym membership. What else was
Hmm.
that? Was just it was on there, and then they started adding things like the acupuncture, chiropractor, massage therapy, aromatherapy, transportation for non-medical services, meals if you came home from the hospital and couldn't cook for yourself, then they have these meal services and you could get the meals for a short duration of time. Additional types of therapies and let me see what else. The pest control and the HEPA um, air quality systems, they started adding all of those. So during the pandemic, all of that was included in all of the plans. And then it was like, this is very expensive. Home modifications, grab bars and equipment. Okay, that was expensive. So they started cutting it down and having certain things in certain plans. And then there was no more federal monies. And now they have to work off their own budget. It's like, well, they're insurance companies that are out for profit. So they have a contract with Medicare, but they're not trying to go in the red.
Right.
Okay.
Hmm. I'll have to read my plan. That gym membership, I just started using it for the first time. What a great deal. I, I have a pool now with water workouts every morning. So I learned that from Leslie. I do feel better, it's wonderful.
Mhm.
They're going to try to keep that, or some plans will, some plans not. I got to find out then.
Yes,
if
you
they
have to
drop.
find out. Some plans will still have it. Some plans will have it if you pay extra for it.
Mhm.
And then some just won't have it at all. So,
Hmm. And they went out already. I think I saw something come through my email, but I never read the whole thing. I guess I just
mhm.
write and read read it
I know
carefully.
it was a lot, and most people didn't read it, just like most people don't read the Medicare and U book. And they do want to make that electronic as well. Um, Look, I don't care if you don't read the Medicare and You book, but don't let them send your Medicare summary notices or explanation of benefits um, only digital. Make sure that they continue to send that through paper because you want to check it to make sure everything on there is something that you did receive. Um, you want to make sure it's accurate because if you want to file an appeal, you don't want to have to figure out a way to get another copy of it, call Medicare to get a copy of it, go into your mymedicare.gov account to pull it up and print it, or to have to go into the library to get it. You want it in your hand right then because appeals have timestamps and you have to get that appeal in
Mm.
the mail um, postage state stamped at a certain time. So you don't want to fool with that. You want it in your hand.
Good
Okay.
point.
hmm Look,
Shirley, I have a
I, I
question.
I said that SHIP is in the book some, so I said let me look to see. SHIP is in the book on page 14, 16, 56, 60, 73, 77 through 78, 80, 83, 89, 94, 100, 105, 108, and 120. Lets me know a lot of people don't read the book. I'm guilty. I don't read it. Okay.
More like a question of where to put it once we get.
Yeah, so if it's on in your email on your tablet, that's fine. If you just have to Google it to look it up.
Uh, I,
What worries me is that I was trying, oh, you have you have your
it's right. Of course, I didn't read it till you said, but it's right. You're right. It's right on the back page. Ship and the phone number and option 4.
Mhm.
As usual, you have to point out the obvious to me.
well,
It's
no one really does. It's a thick book. So right now, this book, I'm not so concerned. I'm more concerned about your annual notice of change and explanation of change so that you know what has happened to your coverage and you know whether or not you want to keep that or you need to change it. Okay.
I have a
If they
question.
have dropped down 200 Advantage plans, there are going to be a lot of people that are involved in this change. And if the Anthem parent company drops their prescription drug coverage, that's over 400,000 people across the United States that will be affected. And they need to know this.
Hmm.
Shirley, I had a question about how you compute income, unquote. Does that include your monthly Social Security payment?
Yes.
Whoops.
Social Security, pension, annuities, added up, that's your monthly income.
Hmm.
So, oh well, yeah, I know. I know they really want to help the poor. Okay.
Right.
So,
Hmm.
So it includes your RMD?
mm-hmm,
Okay.
What's that? RMD?
Required minimum distribution,
mm-hmm. Right? Because that's a
right?
monthly income. Mm-hmm.
What if you have like an uneven income? Like sometimes you get money and sometimes you don't, like in your, little home business or something?
That's on their case by case basis to decide. I suggest that you turn in the information and you share the statement, like if you have a bank statement or something, on the
Mm.
lowest amount Okay.
Okay.
But they do case by case because they will still see that, yes, you still have some income. And that is one of the instances where they will look at if a spouse needs the assistance more so than the person applying.
Hmm.
And they have said that they would give it to the person that needs it and deny the other person. We will see. They used to do it that way.
Yeah, makes sense.
Hmm. Hmm.
Now, is SHIP still going to exist? Is that's
We don't know. We have enough money to the rest of this year. We don't know if we are on the list of the essential, just
Right.
like the Social Security is shut down and they let go the people that were supposed to train us. They let go of some of the people in the top positions. The webinar for the Plan Finder and the Medicaid changes is coming through the Administration for Community Living instead of from Medicare itself.
Hmm.
What is that? Administration of Community Living.
For community living. They were the ones that dished out the grant for SHIP and Senior Medicare Patrol. And half of their staff was let go last year. So, um, it has to be seen as essential. And I'm wondering if they're paying contractors to do the applications and they're paying the agents to do applications and to gather information. And I guess I should share with you too that Georgia is in the top 10 states to be scammed.
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 What does that mean?
Okay, all right. So that
What kind-
means
Hmm.
that with all of these changes, you're going to be receiving more phone calls. Do not say yes, do not say okay. Um, if you get emails, because they're very good now with AI and that sort of thing. And if you get the emails, don't press on a link. If you hover the mouse over where it says it comes from, it will tell you exactly where it actually comes from. Hover the mouse over the link, it will tell you where that link is going. Do not click on it. If you get a phone call and you act suspicious and you say, well, give me your number and I'll call, and they call you and they give you a number, don't call the number that they called. Look up, Google, or what is it, duck.com. Yeah, and find the actual company and call the
Hmm.
actual number. Um, Someone was just saying the other day that their sister got scammed out of money because it came in as the bank and the person asked all these questions and and they reaffirmed all of the information and then someone was taking all the money out of her bank account.
Oh dear.
Hmm. I got an email with a picture of my daughter's apartment building, and they said that they, were surveying me and they saw me through the open windows, dancing around naked, doing
Oh,
drugs, and that if I didn't pay them, that they were going to put it on social media and send it to my employment. Well, I
oh.
knew it wasn't me, so I wasn't worried. But there are people that do certain things that would be worried and
How
would
did
be
you get out
sending
of it?
money.
Yeah. How did you get out of that? You didn't pay. Right.
No, I just ignored it. I knew that was wrong.
Oh, okay.
Well, and that's the major thing. If you get, however you get communicated with, ignore it. And as Shirley says, go back and call the number on your credit card or call the bank phone number. You make the direct call, and that way you're safe. But never, never respond to the BS that comes through. Even, you know, they say, hey, your computer's messed up and we need to take control so we can fix the virus. Turn the computer off.
Mm-hmm. And there's a new one too that I don't know how to get around it, and Senior Medicare Patrol hasn't said anything either. And I guess you would have to call the FTCC, okay, or FCC, but the the thing that says I am not a robot,
Yeah.
and they have those little waving letters and letter numbers, and you have to put those in. You have to be careful with that one now. The I am not a robot. They have learned how to scam that in.
Really? Wow.
They're so clever, these criminals. Why can't we be that clever?
I know. Why
Come on,
use that for good instead of
right.
And they left Nairobi and came across the southern border. So now they're amongst us.
No. I get calls from Romania. Please. They
Wow.
there are people, there are rings now, tens of thousands of people just doing all this cyber fraud stuff.
Hmm.
It's like I got 17 scam calls yesterday. I've never had that many. And
Yeah.
they're going crazy. They're
Hmm.
I mean, they are really, it's like an attack.
It's
And
about to amp up because it is open enrollment and because uh, they have these special enrollment periods. They have these special programs. Um, they have that funeral program, and they keep trying to sell me the funeral insurance. I said, look, I'm not planning on dying anytime soon. So thank you very much. No, I don't need it. But they have that. Plus, last year, the Medicare said that if you have extra help or Medicaid, you can change your plan monthly. So
Oh,
these people are calling, trying to get your information because they know if they get enough, they can change your information, they can change your plan, you know, and they get the commission, they get the commission for it. And so they know they can change it. You have to
oh,
wait till the following month and change it back, but
whoa.
oh my gosh.
mhm.
So Georgia number 10, because we've had that many people that have been scammed, that's the scale. That's the statistics to
I
gather.
don't know why they said that. It's not just healthcare fraud. It is also Social Security scams because they were doing the overpayment and the different things with Social Security. There is IRS scams. There are FEMA home remodel, home repair scams. And those people are likely to come to your door as well. It's like, the government's going to pay. They were trying to get me to get a new roof. The government's going to pay. Well, yes, you had all these hailstorms or something. I said, well, I don't know where I've been, but I haven't seen any hail yet. Okay. All right. It didn't come on this side of the street. So thank you very much.
Wow. Well,
They spend their waking hours trying to figure out how to scam money, how to get the money out of people. And when a scammer or a con artist is successful, they will give your information to someone else, either someone else in another part of Georgia or someone else in another part of the United States.
So they can sell the information. Yeah.
Hmm.
and that paper copy that you should always get from the CMS people, that's important because that's where, and I still haven't finished doing this. It's terrible because it's so a doctor's office that employs many, like maybe 10 doctors. Okay, so it's huge place.
Mm-hmm.
And this is for my eyes. So they said they did something and they didn't do it to me, and they charged Medicare for it.
Mm-hmm. Mm-hmm.
$1,400 they charged. It wasn't a little thing. Okay.
Right,
And
right.
so I go through it. I do it kind of randomly, maybe not every single month, because they don't send them out monthly like
No, I think it's quarterly. Mm-hmm.
yeah, quarterly. So you have to really, sometimes I had that particular one, I had 19 pages because I had so many illnesses and I'd been in the hospital. There's just so much stuff going on. So I'm not like that anymore. But what happened is that 1,400, I called, I reported it to Medicare. They said, well, you call it fraud? I said, absolutely. They didn't do that to me. So they said, thank you very much. Do you know at the end of the next year, on the very last form I got, statement that I got from Medicare,
Mm-hmm.
they resubmitted it, the exact same
Wow.
thing. And
Wow.
I think that's how that's some of the way that there's other from within the system, from within.
Mm-hmm. Mm-hmm.
That's where that, because I told that story before. That's where the lady at the billing office, when I called her, I said, you must have an error because this was never done to me. Well, what do you care? Medicare pays for it. That's what she said to me. The billing office of that big doctor.
Wow.
Well, needless to say, I don't go back there anymore anyway, but because she said that to me, that's why I called Medicare, because I thought it was just an error,
Mm-hmm.
billing error. They're doing, it's coming from everywhere, and it's just not, it's not okay.
No, no, it's not. And it
Just,
could have been something that you actually did need, and then you would be denied because you have already had it done.
there you go. How many times can you always it for? Eye duct. I knew eye ducts. You
Mm-hmm.
think you would know if somebody put in 2 new eye ducts?
Wow. Right.
No, I think you would know. They did not do that. So, but they charged for it.
But the other trick is you only want to get your blood tested more than 6 months apart.
Mm-hmm.
If it's within 6 months, they'll charge you.
Unless it's for a I think
Specific. Mm-hmm.
I've had it done for a specific, very like they're trying to, it's part of them studying me to see something, that they need to know. They can only detect through the blood. They'll do that, but this not regular. You're right, Dick. They just have to have the the documentation.
Mm-hmm.
Jeez.
Mm-hmm.
By the way, I have a news alert here. Georgia's beating Kentucky 21-7 in the third quarter. You can take that to the bookie.
Thank you.
Oh,
My son told me about that, that 21-day challenge we see the ads for. And so he signed up for it and he said it was really good. So I thought, well, I'll sign up for it and he can help me with my homework. And so I've done 2 lessons so far. So I'm going to learn how to do all these scams because
Take an AI class, really. Oh, that was the other thing. Someone had, what was she doing? She, I forgot who she said called her. And they went over everything, and then they asked her to confirm the numbers and letters that she got on the confirmation for what they were doing. And she read it all back to them. Let me tell you, AI can use that. They've been recording her voice while they were talking. And when they get you saying the alphabet and the numbers, they can make an email or whatever with your voice.
oh
And
my,
just, make up the words, make up the conversation, and use your voice. So if they get information about family members or friends, they can send them email or a phone conversation saying that you're requesting money. Let's just say, well, for our group. We want to do something really, really nice for Leslie. So please send me $20 and we will get her such and such for her birthday or for whatever the occasion is. And they can use your voice and make it sound like you.
Uh-oh.
I know. Do not repeat the confirmation number now.
No numbers.
Make sure it's someone that you have called, not called you.
And
Okay.
never say yes. Question.
Exactly.
Never say yes.
Are there classes you can take? Really? You can take
That's what I'm,
or AI.
AI classes? Yes, there are.
And what did you just say, Nancy? You were taking?
what I'm doing, the one called COURSIV, Course IV, I think. Something very close to that. 21-day challenge to, you learn something new on AI every day for about 15, 20 minutes.
This isn't for scamming. I thought they were to learn how to not have because
Oh, I would. No, I'll learn how to do that. I'll put Shirley's face on your background and
Right, right. Now you have to teach us once you learn.
it's assuming I'll learn it and remember it by next month. But maybe our APPA Zooms, we're going to have some kind of secret password or emotion or.
that's scam classes for older people. Okay, so anybody want to start a business? But last year I did answer the phone one time
Mhm.
because it didn't say scam. It just said Atlanta, Georgia as the thing. So I thought I could try it. Who's that? Because I was waiting for a phone call back from somebody. So
Mhm.
but this guy started talking to me and asking me, he started asking me too many things. And I noticed that, but then when I said, well, I really gotta go. He says, well, you're too smart anyway. You know what he admitted what he was doing. Because he was trying to get me into the loop
Mhm.
that he was
Mhm.
trying to do it. Yeah. So that's why I don't answer anymore because is he talking? And plus my family tells me that's against the law inside my family for me to answer anyone that says anything like scam or that I don't recognize. Because they
Mhm.
can always leave me in a voicemail, but sometimes the voicemails are very cagey. Oh,
Yeah.
Mhm.
Mm-hmm.
They're trying to see if it's a working number. If the voicemail is cagey, they're trying to see if this is a working number. Okay.
do you know, I just now, because I'm sitting here, I just got an email from my Florida retirement system.
Mhm.
I worked my whole life down in teaching. So, this is just yesterday, I got this email. And it's an email that said that they want to know if I'm dead. So would I please verify who I am?
Mm.
Now I'm saying to myself, there's something wrong with that picture because how will I know who they are
Mhm. Exactly.
anymore?
Yeah.
This is getting to be like that. And this is
Mhm.
destroying the fabric. It is
Yes.
destroying the whole fabric of how
Yeah.
have any confidence. I also, because I got scammed, my Amazon account got scammed. Then TransUnion wants me to go in there, and I have all this paperwork that I have to do to get everything blocked. And then it's like everybody wants my IDs, but it really gets suspicious, doesn't it?
Mhm. It does.
All my
It
numbers.
does.
They want all my numbers.
Mm-hmm.
Just amazing.
Mhm.
Just
Mhm.
now, maybe I don't. This is all just happening now, so that's why I'm.
Mhm.
Is there a class I can take? Whoa, that's funny.
Hmm.
Yeah, the thing possibly, you might want to have senior Medicare patrol come in um, one time and talk about the different scams and ways to protect yourself.
Senior medical.
We know that we need to freeze our credit cards, and then if ever we want to use it, we can unfreeze it. That helps, but there is no way to freeze your Medicare number.
There you go.
And my social security number is on the dark web. So I have no idea what that is. That's probably how they got me for that dancing naked scheme.
Well, but see what TransUnion's email said is that they actually got hacked, whatever
Okay.
Right.
that
Yes.
that they got certain, and I was one of them,
Mm-hmm.
the date of birth and my social security number.
Mm.
Now that's totally got nothing to do with me. They have what kind of agency is that that keeps track of all our credit stuff and all that they can get broken into? That's not a good sign.
Mm-mm.
Not a good. So what is this, the Senior Fraud Patrol, you said? What is that?
Senior Medicare Patrol.
How do
That's
we get?
another, yeah, another nonprofit organization that so far is being funded by the government to alert people, help you to protect yourself, detect whether it's a fraud or a scam, and have someone to call. And what I like about them is that number one is nonprofit, so they don't sell anything. And then if you call the number Monday through Friday, they have a live person that answers, and you don't have to do
Yeah.
all the, oh, I hate that, pushing those buttons and, checking those options. Yeah, but
So
they actually do, even if you just suspect it's a scam or it's fraud, and it may not be, but they will at least investigate it. Someone told me before that they had called the 1-800 Medicare, and the person was like, oh, like it was no big deal. But it's always a big deal. It's over $65 billion that people are getting through these health care scams. Have no idea how much it is through the other
oh,
scams. Come
I-
in, take your money, destroy your home like they're going to fix it, and then don't come back to
Mhm.
repair it.
wow.
Steal your home with that title thing they talk about. Yeah.
So is it Senior Medicare Patrol for Georgia? Because when I just was looking it up real quick, it came up for Ohio and California and stuff. Is
It's national, just like SHIP.
okay? It's a national phone number that we
Let
call.
me see. I have a local number. There is a national number too, but
Okay, I got it. It's Georgia's 888-876. You tell me if it sounds familiar. 877-272-8720.
that sounds like it. Yes,
Okay,
that's it.
okay.
Will they tell us more than what you're telling between this conversation? You think that would still be worthwhile? Because we don't have speakers lined up for November and December.
I think it would be worthwhile, especially since they're amping up the scams.
Right.
See?
Okay. Yeah, Leslie, did you take down a number there?
Yeah, no, I have it. Yeah, I have it. I just looked it up on my phone, the whole thing.
And schedule somebody, okay?
Okay. Yeah, the Georgia office, here it is, 470-588-5252.
470, what I say it again?
588 5252.
5252. Jeez. Boy.
Thank you. That would be.
Oh, you're welcome.
Mhm. I had one of those where you get, they'll say it'll be a long hold, but we'll have somebody call you back.
Mm-hmm.
And so he called me back, but it was like the next day or something. It was like, and so then he wanted me to verify my information. And I said, you're calling me. You see the information. You tell me what it is. I'll tell you the street name. You tell me the rest or something.
Exactly.
Do half and half, but I'm not going to do this whole thing, so,
Mm-hmm.
um,
I know. You have to be careful.
mhm.
Wow, about everything.
Mm-hmm.
It's just, and I'm trying to get more steps in my life. You do be healthy, get more steps, go to my pool and stuff.
Are you still getting in your pool okay? Does Emery, that pool you went to, is that working still?
Oh, yeah, but
Okay.
I have original Medicare. I don't know if that's what it's under or not, and it's a, I have also, my supplement plan is very, very, very good.
Hmm.
They don't want, even when I call, they say, don't you ever get rid of this.
Really? Okay.
Yeah, oh, but it's expensive but good because it's attached to it is a lot of like home care and things like that. Things,
Mhm.
yeah. But I didn't know that when I got it. But when I once you get it, you can't just quit medic. If you just don't quit all these things because then you have to go back to today's price, not back to the price you got when you came in and all that. It's just it's all
Really?
Mhm.
yeah. I don't know if Medicare Advantage is like that, but you're older, of course you'd pay more if you were coming in for the first time.
Mm-hmm.
No, see, the Medigaps are private insurance, so they
Yep.
answer to the Office of Insurance,
Mhm.
and that allows them to deny people, allows them to take your money and make you wait before they start paying for the services. You know, they're waiting to see if something happens to you before they have to start paying. Um, and it's, you know, it's a lot. The best time to get it is when you first are fully on Medicare, when
That's
they
it.
don't do underwriting.
Oh,
And
Mm.
um, I
and
was telling people about the Cobb and the Covington, where they were cleaning the medical instruments and putting fumes in the air. But we had that fire not too long ago, and they closed down the freeway, and then they opened up the freeway and said, okay, the freeway's open and you can drive on it now. I had the air conditioning off, I had the windows up, I had my mask on, and I still had burning in the eyes and I could smell it.
Mm.
So, you know, it's in the air. It's in the air. So just going down the highway, and they are looking at certain zip code areas in what in Rockdale, Newton, to see and to say who was affected, but the hundreds of people that went down I-20 and rode right through it. Hmm.
Yeah.
Hmm.
oh, this guy, I just am looking all this up online and it has a whole list of Medicare scams, what they look like. And this is the one I just got yesterday. It says scammers may offer free services, then ask for your Medicare information. I just got that because that's when I answered that call yesterday. And he kept saying, well, you're going to get free support for your hands and your fingers and your back for because
Braces.
if you have braces if you have arthritis.
Hmm.
I said, what are you talking about? And
Hmm.
I said that. I kept saying that. And he said, never mind. He hung up. But that's what that is. It's right here. It says that's offering free because he kept saying, it's free. It's free. You
Hmm.
always, that's what you really, that's a giveaway, right?
Hmm.
I'm gonna tell you all a system that works for me on my phone. You know, you have all these different ringtones on your phone.
Mm-hmm.
I have a ringtone for my teacher friends. I have a ringtone for my church friends. I have a ringtone for all my doctors, a ringtone for my family, and then just basic friends. And then I have just a general ringtone. So if it's a general ringtone, that means somebody's calling that I don't know, and they'll leave a message. And if it's a scam, then I don't even have to respond. But these different ringtones help me out a lot. They really do.
Interesting. Okay. I
Thanks.
I think just add it. I'm just looking at all the things that are online about the scams of Medicare. Yeah.
Anyway, Shirley, I'd like to thank you so much for coming to us every year like this. And you're just so loaded of good information. And of course, now I'll pay more attention. Sometimes I don't pay that much attention, I just kind of let stuff go and no, it's not like the past. The present is
No.
different.
Yes.
Well, we certainly appreciate you, yeah. And in view of the furloughs and stuff, honestly,
Right. You're not
I
sure
hope
who
things
was
get
there
better.
and who
That's
was
the
coming
thing.
back. Who are they going to let go?
Yeah,
You don't know. And they already have kids straight out of college that don't know anything. So, so
I don't get the philosophy behind some of this stuff either, unless it's just to eliminate people and but it seems to me like some of this stuff needs to be kept. And the poor people that, are on the rolls.
hmm It's like I understood when they said they were going to get rid of waste because there is a lot of waste in the government. But they just started chopping
Yeah,
departments and people, and instead of doing the investigation and saying, well, this is where we need to cut it out or cut back or so.
Did you have to answer those early emails when it said, what did you do this week or what did you do last week?
What?
And you had to explain what your job was. Remember when Doge first came and they sent all federal workers emails saying, respond to this email and tell us what your job is, what you did.
Oh
And
gosh, no. I'm sorry. Well, it would have made their head swim, so go ahead.
Yeah,
well, that's what I figure, if your job is there, but some people really don't know what they do. They're doing something for some manager that they don't even know what he does, So they can probably cut back, but I think the idea was to send things back to the states too. So all the healthcare would be in Georgia. We don't have to go to Washington, DC and all their tinkerings every year. And if we're in a state like Georgia, then your program would be a good one.
Thank you. Mhm.
but
But
there's
we'll see if they feel it's essential or if they feel like if it's a duplication of something they already have in place.
they already have a huge center for isn't it for verifying claims and talking about your claims and all that? It's huge. I forget where it's centered or if there's regional centers for it that you call, because I've called them in my life. I remember somewhere along the line.
What type of claims? What do you mean?
For your medical claims.
Yeah.
Oh, bills that were getting denied or something?
Yeah.
Mhm.
From my brother when I was taking care of him.
Mhm.
He was not doing well.
Well, they do have specialized Medicare lawyers, right, that take care of people like that.
Mhm.
Well, no, there's a big center. I forget what they call it. I just saw it on here a minute ago, but I'm in the middle of all the different scams now. 10 top senior scams, and I avoid them. We definitely need a speaker on some scams. Maybe that get a larger crowd. Or maybe they'll ignore my email because they'll go, this is a scam.
They won't answer the phone.
Well, we appreciate this, Shirley, because I anyway.
Yeah. If you need a recommendation letters why we depend on you, then let
Thank
us
you.
know.
Yes, I certainly will. Thank you so much for having me. I'm sorry I didn't have better news or even more news, but be on the lookout. Okay. Bye, everybody.
Okay.
Thank you so much. And we don't know what we're having next month, Nancy.
Yeah, if you want to call that number on Monday, let's line them up.
I can't. I have so much stuff scheduled for.
Oh, then just text me that number. You had your pencil in hand, so I was relying on you. I'm sitting outside.
Okay.
Text me the number. I'll call them and see if we can line them up. Does everybody think that's interesting enough to do that?
Would you be interested? Would the people here be interested in something about?
Yeah, Pat is. That's a can see one hand.
Yes, no, anybody? I think it's an interesting thing.
We'll get together and talk about our scams anyway.
What's it called? Senior Medicare.
How'd you do that, Pat? Boy, she did all these fancy things. You got a thumbs up.
It's under reactions at the bottom of your screen. It
Right.
gives you lots of reactions.
Oh, yeah.
I'm just learning how to do it myself.
Oh, what fun.
Okay, folks. Any other things that anybody needs to talk about before we shut down? No, yes?
I was just figuring out how to get my chat here. So Wesley, I'm glad you're back. I think you're here, right? Are you on?
Yeah, I'm here. My computer
Wesley was,
is so bad today. I mean, I missed a lot of the information that and my video doesn't work because when I logged in today, it was saying you got to log into Zoom Workplace, and the video didn't work. And I don't know. I've just had like a terrible day. It's been breaking up like crazy today. I don't know. So yeah, I had a bad day today. I want to get a new computer or something. But
Maybe it's yeah.
yeah. It just I've never had a day like this today with it. I couldn't get a lot of
Uh-oh.
she's
information
breaking.
that Cheryl was giving because it kept dropping off,
Yeah.
dropping off. So I have to give her a
Breaking.
call one day next week. Yeah.
Oh, I bet you piped in for a minute anyway. Yeah.
Yeah. But I'm going to drop off because it's just terrible.
Well, before you do, Wesley, you'd asked about having more speaker about pain.
Yeah.
Do we have some group input about that? Some good advice who we could get as a speaker on that? Anybody else on the group that has a good
Mm.
pain management?
You know, I was there was this doctor that Pat Harris gave us information to that said Shepherd Spinal, and she works with a lot of I guess post-polio and people who have spinal injury and everything like that. And I was just thinking just off the top of my head, it would if we could probably reach out to her and maybe have her for a Zoom meeting sometime in next month, the next couple months. I can't remember her name right now, Pat. You probably you probably remember her name.
Dr. Vinegar?
Yeah. I was just
She's
thinking.
not taking patients. She's not taking patients right now, but she probably would be an excellent speaker. She's my doctor.
Yeah. I was thinking about that. So maybe we can reach out to her to see if she would be willing to join in for give us some information on the Zoom meeting.
Yeah, she's on that list that I sent out with all the
She may have
doctors.
some ideas about how to deal with pain and maybe some other alternative we could use, and maybe some other doctors that we could reach out to. So it was just a thought I had in my head that maybe she'd be a good candidate for a Zoom meeting.
Okay.
What's her name?
Dr. Angela Vinegar.
Yeah, Angela Vinegar. Yeah.
She's on that list that I sent out with all the
Yeah.
doctors.
Yeah.
She's the first one on that list.
Yeah, I tried to reach out to her to get an appointment too, but she's just she wasn't taking any patients. I guess she's very, very busy. But I did a read on and read her bio about her studies and a lot of different things that she's been involved with and working on. I said, well, she'd be a really interesting person to give some information to us. If we could get her to do it.
Mm-hmm. Right. Mine's frozen now. Okay. All right. We're glad it's 2:30. Anybody else have anything they would like to talk about? Now I'm getting frozen here. Okay.
Um,
Anyway, it's nice to see everybody today. Everybody looks well.
Yeah.
Carol, were you saying something?
I was just saying it's nice to see everybody today. Everybody looks well.
I'm in the car, so.
I thought you were saying something.
No. On my way to the beach in North Carolina.
Carol. Oh, there she is.
to
Yeah.
the beach.
Yes.
Other people looking happy.
But not bad. My sister and my cousin are with me, so we listen to the presentation until my phone is about to run out now.
Your picture's breaking up.
So if I get cut off, guys, have a good weekend.
I'm sitting out here on my new patio that's underneath the deck.
Okay, I'm going to close it down. Everybody's done.
Yeah.